The following portion of the Arizona Daily Mix is sponsored by Dignity Health.
Robotic surgery allows surgeons to diagnose and treat conditions and faster with fewer complications than traditional surgery. And here to tell us more about this is Dr. Samad Hashimi with Dignity Health Norton Thoracic Institute. Welcome.
Thank you. Thank you for having me.
It is such a pleasure to have you. I know you've been doing these surgeries for about a decade in the Valley. You've personally been part of hundreds of lung transplants, which is so exceptional and extraordinary. And I'm sure when you were in medical school, you couldn't conceive of a time when you would be doing so many robotic surgeries. In your mind, what is the advantage to both the doctor and the patient?
So if you look at surgery in general, historically we had to make bigger operations in order to get in and take out tumors in somebody's chest wall, but in order to get there, and you have to get your hands inside, it requires a bigger incision, which means if everything goes, assuming everything goes perfectly, that patient still has to recover, and the recovery time will take forever. So as surgery evolved, minimally invasive techniques came about. Initially laparoscopy, which pretty much means small incisions, and you go with cameras and try to do the same operation. There's several advantages to laparoscopy. And then as an evolution to that became robotic surgery, which is essentially gives you 3D visualization. You can operate on vessels with precision. And the other major advantage of it is that it gives you a way to manipulate tissue and instruments inside the body. So, and it can mimic the movement of your hands. So essentially you can take big tumors out without making big incisions. And so the advantage from a patient standpoint is that now you have a good oncological operation. You have less pain, hopefully, and you have earlier return to activity. So those are the advantages of a robotic platform.
So you're talking about a mass in the lung or somewhere in the abdominal cavity, and if it's a larger mass, using robotic or computer-assisted surgery, you can get that out with a smaller incision, even if it's a bigger tumor. Right.
So we can do all the operations robotically, and then one of your port sites might have to be slightly enlarged to take it out. But the difference is, so a lot of the pain happens. So if you're talking about a chest operation, for example, lung cancers, you know, you would have to, we don't have to break the ribs to get inside of somebody's chest wall. We basically do like minimal spreading, and then you can take out a big tumor from a small incision. So that's, you know, that's where the decrease in pain comes in.
And the Dignity Health Norton Thoracic Institute has been a leader in the Valley doing these minimally invasive robotic surgeries. In a typical day, what are you usually seeing? What are you doing the most of using this technology?
So obviously, I've been doing it for over a decade now, and we have a number of my partners now that are fully trained in robotic platforms. We've done over 1,000 of them. What we do a lot of esophageal tumors. We do a lot of lung cancers, mediastinal cancers, or tumors, because they're benign and malignant. So those are the things that we see the most of.
And certainly if you're faced with this diagnosis, you want to recover quickly, especially with a cancer, because you might need oncological treatment following surgery. So you want to recover if you're going to need radiation or chemotherapy.
Yeah, and you know, in the older days, we used to have to wait for 6 to 8 weeks for somebody to recover before they could get, if they needed to have chemotherapy afterwards. They needed to wait that long to recover from surgery before they could start their chemotherapy. Nowadays, with minimal invasive platforms, you don't have to. That time period is shortened. So in case of somebody who's dealing with, you know, a life-altering diagnosis, that makes a huge difference. So they can start treatment earlier.
The sooner yeah, right, especially if it's an aggressive cancer. Thank you so much. It's been such an honor and a pleasure. If you want more information on the Norton Thoracic Institute, you can visit the website on our screen, or of course you can always check out our website, cw7az.com, for more information. Thanks again.
Thank you. Thanks for having me.
The preceding portion of the Arizona Daily Mix is sponsored by Dignity Health.